Have you ever had a patient walk into your office with a list of supplements they've heard about on social media and they want to know your thoughts? Maybe you've been asked about whether turmeric will help their arthritis or if they should start taking a probiotic. To make things even more complicated, what if your patient is going through cancer treatment? What do you say then? It's so important to know what supplements our patients are taking and whether they are doing more harm than good. This week, I sat down with Krystle, an oncology dietitian who shared her expert take on four of the most popular supplements on the market right now: turmeric, vitamin D, probiotics, and athletic greens. We're breaking down the evidence behind each one so you can confidently guide your patients when they come to you for advice. I'm Colleen Sloan, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. P.S. Shout out to all the PAs listening during the week of October 6th, because it is PA week, and I just want you to know how much I appreciate your work and dedication to patients. So is turmeric really the anti-inflammatory miracle that it's hyped up to be? Should vitamin D be on your radar for more than just bone health? Are probiotics worth the price tag, or are they just a trendy gut health fad? And what about athletic greens? Are they the magic bullet for optimal nutrition, or just an expensive daily habit? You're going to walk away with some clear takeaways, including the key questions to ask your patients before they reach for the next miracle supplement. Trust me, this conversation is going to have you rethinking some of the most common supplements your patients are taking and how you can guide them better. So get comfy and let me introduce you to Krystle. She is an experienced dietitian, educator, scientist, and science communicator. In addition to her current position as assistant professor of instruction in the Department of Nutritional Sciences at UT Austin, she is a board-certified oncology dietitian and owner of the private practice and social media account Cancer Nutrition HQ, where she strives to combat misinformation, share the latest research in nutrition and cancer, and translate the science into everyday actions cancer survivors can take to support their health and quality of life with nutrition. Krystle is also a founding board member of the Moving Beyond Cancer Collaborative, a nonprofit that provides accessible and affordable integrative oncology, health, and wellness services. All right, well, enjoy my conversation with Krystle. Well, hey there, Krystle. Thanks so much for being here and welcome to the show.
Thank you. I'm excited about our conversation today.
Now, before we get into some specific supplements, I would love for you to discuss if there are any supplements that would be harmful or dangerous or maybe even contraindicated in patients with cancer, whether they're in remission or currently undergoing treatment, because this is your wheelhouse and this is your specialty.
I really take a closer look at any herbs and botanicals, especially products that kind of fall along this line that are listing on their label what they say proprietary blends. So that is, again, under this regulation, companies can put their ingredient list. They have to have their ingredients, but they could put proprietary blend, and then they don't have to list the exact amount of each ingredient. And so I am looking out for those types of products because then we don't really know how much is in there of this particular ingredient and whether that might play a risk in interacting with their medications. And so this is a really big question. And I like to start off with explaining why we're concerned about risks, even with things as simple as a multivitamin. And what we're really looking out for and concerned about is that some herbs, botanicals, even vitamins, minerals can interact with enzymes that also metabolize drugs or metabolize chemotherapeutic medications. And if they interfere in a way that reduces the metabolism of that medication, then you actually end up with more of the active drug, because in metabolism, to get a little more specific here, we have in our liver and a little bit in our intestine as well, a CYP450 enzyme system, which metabolizes a lot of medications. It's actually estimated that about a third, more than a third of chemotherapeutics go through one specific CYP enzyme in there. So to kind of take that back is if a supplement interferes with the activity of this enzyme, again, we can end up with more drug in the system, which can increase the risk of side effects, Or it can also interact in a way that it causes more metabolism of that drug. So you actually end up with less active medication. So to understand when we're in active treatment, that there is often a very narrow therapeutic window where they're dosing at enough drug that's going to cause an effect, but also a little bit higher could cause more severe side effects. And so we don't really want to risk getting out of that therapeutic window and ending up with less active drug than what is needed to elicit an effect, or more active drug that's now increasing the risk of side effects. And I guess I'll kind of back it up here. It's like, well, is there one specific supplement or nutrients? It depends, right? It depends on the person's medications that they're on, what their therapies are on, what type of therapies that they're getting. We need to take a closer look to determine what's safe for them.
Do you think that this is an important question for clinicians to be asking their patients, whether they're undergoing cancer treatment currently or in remission, is, are you taking any supplements? And if you think so, what is the best wording of that question that we can pull that information from our patients?
That's a great question. So it estimated that over 72% of cancer survivors were taking a supplement. And of those, over 40% had not discussed this with their provider. And I don't think it's that they are trying to hide this information. It just might never be asked, right? And so it can be as simple as, are you taking any supplements currently? And defining to them, you might need to define what a supplement is as well. I've had that in my own personal experience when I'm asking people about supplements. They might not consider something like a multivitamin or vitamin D or omega-3 as a supplement. They think that that's what everyone should be taking, or they think that it's not something worth mentioning. It might just list things like herbs or botanicals. So not only asking, are you taking any supplements, but defining what that could be. Like a multivitamin, omega, a protein powder also gets regulated like a dietary supplement. And not go down that rabbit hole, but not all protein powders are the same too. And I've had patients that are taking these protein powder drinks, but there's more than just protein in there. There can be herbs, botanicals, probiotics in there as well. And so we have to really get detailed in the question, because the average consumer might not even know that what they're taking is a dietary supplement.
Such a great point. It's like you have to be little detectives when you're questioning patients, because if you don't ask, they don't really know to relay that information, because in most people's minds, hey, a multivitamin is great. I've heard I should have fish oil because it's good for my heart, right? I mean, probiotics I've heard are really helpful for my gut. And so, especially for those undergoing cancer treatment in remission or are hopefully trying to prevent cancer, they think all of this is beneficial, because in some it might be. And that's what a lot of the social media headlines are saying. But I love your point that we really need to understand and explain to them, okay, this is a supplement. I need to know exactly what you're taking. And I love that you pointed out the metabolism effect of that, because especially if you're not in oncology, you might really not be aware of that, and how that can change the efficacy of that cancer treatment significantly. So those are such important questions that if you guys are multitasking, come back to us. This is an important thing to be asking your patients about what dietary supplements they're taking, and get into the details of specifically what herbs or pills or powders they might be consuming in addition to their diet. So I love that you went there, Krystle.
I think it might be helpful to ask, are you taking any medications or supplements? Like, it's lumped into one big question. And if you're working with patients who are taking multiple medications, they might just start with the medications and then forget the supplement part. So are you taking any medications? And then are you taking any supplements? So make that a separate question. And yes, as you said, being a little bit more of a detective, because I've also had experience where someone's like, well, I'm just taking a calcium supplement. And then I ask about the brand. I'm like, well, actually, that calcium supplement has vitamin D and vitamin K, and you're taking a multivitamin that has vitamin D, and you're taking a separate vitamin D supplement. So sometimes asking about the brands, because that's letting us know a little bit more detailed. And with over 55,000 dietary supplements out there, it's really hard. Not all vitamin Ds are the same. Not all omega-3 supplements are the same. That depending on the brand, there might actually be other nutrients in that supplement.
I love that point. And if you're a clinician listening and you're like, okay, I'm feeling overwhelmed because I don't know that much about supplements, and Krystle is obviously an expert in this area, don't feel overwhelmed. I would love if you just ask your patients about what medications, supplements they're taking. And if you find that they might be on 2, 3, 4 different supplements and you're not sure, guess what? There are registered dietitians like Krystle out there who love to work with patients and really help you make sure that the patient is taking appropriate medication and supplements and get them on the right path. So don't feel like you need to figure all this out. That is the purpose of this podcast. And remember, if you want to connect with the dietitians, I have quarterly virtual meet and greets with dietitians. I put the link down below. If you're interested in that, just go ahead and let me know and I'll get you signed up for the next one. And this would be a great way to connect with someone to help you kind of navigate the supplement world. But if you can just get that question started, you can at least do the investigation and lay that foundation for understanding what the patient's taking and if there's any issues or not.
Yeah.
So let's get into the meat of this subject. And I'm so excited to go into these different supplements because your Instagram reels and lives are so, so helpful. And I would love for you to just educate us on some of these hot topic supplements. So first, I would love for you to talk to us about vitamin D.
Sure. So vitamin D, one of our fat-soluble vitamins, there are pretty limited dietary sources of vitamin D, fatty fish, fortified milk, but we can also synthesize vitamin D. Here in Texas, I get plenty of sunshine, but in other areas of the country where we have those winters or bundled up, there can be less synthesis of vitamin D. And we know that vitamin D helps promote calcium absorption, so it's going to help support bone health that way. But we know that vitamin D does more than that. It helps support immune function, insulin sensitizing. So it's doing more than supporting bone health. And there's not a lot of dietary sources of it. And for some people, there can be limited ability to synthesize vitamin D. So even being exposed to sunlight, if you have more melanin in your skin or older skin, or you have a lot of sunblock on, which we want to promote sunscreen, there can be less synthesis of vitamin D. So the concern is the risk of vitamin D insufficiency or deficiency. I see this in working with my cancer survivor population, those going through treatment and even after treatment. I highly recommend before starting a vitamin D supplement to get their levels tested, to not just assume that they need a vitamin D supplement, not just guess what dose to take, because there's quite a range, as we talked about these supplements. And that's something the provider could test for and make sure that they're prescribing a high dose for a short period of time to get them back up to normal, and then test to make sure that it's back up to where it needs to be. In the cancer world, though, yes, higher vitamin D levels have been associated with overall survival, a couple of specific cancers, colorectal cancer progression-free survival, breast cancer specific mortality, and all-cause mortality. So we know that maintaining adequate vitamin D levels might have some protection against recurrence and promoting survival. And there has been some couple of studies looking at vitamin D supplement use. It wasn't a randomized controlled trial, just looking at a population, say who's taking a vitamin D supplement, and associated with reduced risk of all-cause mortality in cancer survivors. So we need to be taking supplements that just keep people at the recommended levels, but we don't want to be super dosing and guessing how much to take.
Now, I'm curious as to the difference between like vitamin D3 and D2 and those different ones that you can find because it can get a little confusing. And so, can you give us a little direction on maybe they're a little insufficient? You should take a vitamin D supplement. And I think usually the conversation ends there in the clinic because we don't know what to say. And so what would be the next best thing to say on like how to direct them when they're at the shelves at the supermarket? What do they look for in general, or what's the main difference between those different types of vitamin D supplements that are on the shelves?
Sure. So D3 and D2, anyone taking that supplement, it's going to increase vitamin D levels. D3 will do it faster. And as I said, there is a lot of range of vitamin D doses up there. So the upper limit is 4,000 IUs. I have seen supplements at 5,000, 10,000. Like you can buy higher than what is recommended. So yes, we definitely want to give some guidance. One is to check, well, maybe they might already be taking it. A lot of multivitamins have vitamin D in it. If someone's taking a calcium supplement, it might actually already have vitamin D in it. So double checking with those. And then I'm generally recommending somewhere along the lines of our RDA. So the RDA for most adults is 600 IUs. For those over 70 years of age, is 800 IUs. So somewhere along that line should meet most people's needs if you're looking to maintain. Again, if you need them to increase their levels, then generally you're going to need to go higher than that. but being careful about that dosing. And then this is a fat soluble vitamin too. So having some fat, taking it with a meal can help support the absorption of that nutrient as well.
That's a really helpful pointer. I think a lot of us know that like iron supplements should be taken with vitamin C rich foods. And sometimes
Mhm.
you might forget that vitamin D, oh, yeah, it's fat soluble. So let's do it with some source of fat. I think that's a really helpful point. Now, if someone maybe is deficient or even insufficient, are you recommending they take a supplement and also educating them on vitamin D rich foods that they should include in their diet? Or is it either or?
Great question. I think the challenges is that the vitamin D rich foods are pretty rare. And generally, if someone's not eating them, it's because they don't really like those foods. But I give guidance on that. You can get vitamin D from fortified milk. I know some plant-based milks are starting to fortify with that as well. So that telling them that they can look for that on the label, and fatty fish could be something that they incorporate. Don't really want to say go out in the sun with no sunblock either. So it depends. And that's really the challenge, is because we could both stand out in the sun for 10 minutes and you and I would both synthesize a different amount of vitamin D.
Yeah. Okay. Super helpful. Let's move on to probiotics, another really hot topic, always in the world of like gut health and
Mhm.
feminine health and things like that. So, who needs a probiotic? When should we do probiotics? When might it be contraindicated? And just kind of give us some facts about what to look for on probiotics.
Sure. So probiotics are live microorganisms that are intended to have health benefits when they're consumed. There are some foods that have probiotics, like yogurt, right? Is one that bacteria is part of what makes yogurt. And there is a lot of research in this area. And the potential mechanisms of benefit is that if someone has dysbiosis, so maybe an overgrowth of some quote bad bacteria, not good for that individual's health, then supplementing with some specific strains of bacteria might get that to a better balance. So I like to start off with, we already have bacteria in our intestine, lots of them. So it's not that we need a probiotic to get these bacteria. But why they're beneficial too in the gut is that when they are fermenting things like fiber, these postbiotics, their byproducts can help support immune function and intestinal health. So we have a great symbiotic relationship with these. Also shown to help influence immune response, and some bacteria even synthesize some vitamins like biotin and vitamin K. Now, that market has exploded and it's like being marketed out there that everyone should be taking a probiotic and your gut health is terrible if you're not taking a probiotic. When, like I said, we all have these bacteria in us, and something that helps support the diversity and the abundance of these bacteria is fiber and plant foods and a diversity of plant foods. So I don't like to say this is a shortcut for good intestinal health, that we can actually support the ones that are already in us and help maintain a good, healthy balance. Now, that said, there can be situations where there can be dysbiosis. Again, working in the cancer population, probiotics have been shown to have some benefit for those that are struggling with things like radiation induced diarrhea or chemotherapy induced diarrhea, even some research on oral mucositis and head and neck cancer receiving radiation in that area. So there might be a beneficial relationship there in a population that could use that, but also want to be very careful that these are live microorganisms. So those that are immunocompromised, plus maybe have some poor intestinal health and more permeability, that these bacteria could translocate and end up in systemic circulation. Right? And for someone who is immunocompromised, maybe those bacteria, they're not able to handle that load of bacteria. So they just like to put that caveat out there, is that we don't know if it's safe for everybody in every situation. And then as far as the guidance on using probiotics, one is to not make the assumption that everyone needs it and that you need to be taking it forever. Should be making sure that there is an intended use. You might be trialing out. And if someone's not getting benefit from taking this probiotic to help with their chemo-induced diarrhea, for example, then we don't need to keep doing this supplement. It is also really hard in this research that, although I said there's been some research in this area, there's even been meta-analyses on this, that studies are using different strains and different combinations and different amounts of bacteria. So we are not at the level of, all right, you're dealing with this specific issue, you need to take this strain at this dose for this long. We are not even really close in this area. But for generally healthy adults, there really isn't evidence to support that they need to be taking a probiotic for a long period of time.
What a great explanation. I also love
Mhm.
that you and dietitians at large tend to take a food first approach. And so I have talked about some probiotics in the past in some previous episodes where I did gut health, but specifically, are there certain foods that you might recommend that patients just start consuming in general? Or would you take the same precaution with these probiotic, prebiotic type of foods as you would if they were taking it as a supplement?
I always promote the diversity of fiber containing foods. Like, sure, beans are higher in soluble fiber, that fermentable fiber, so are oats. But I really want to guide them towards, well, what are the foods, especially in working in cancer, that you can tolerate right now, that you can handle the taste of, that aren't disrupting your digestive symptoms, and try to incorporate those as best as possible. But I really like to promote more diversity rather than jumping straight to a fiber supplement either. Again, we know as well that not only are these plant containing foods sources of fiber, but they also have things like polyphenols that some bacteria like as well and can help support the health of the bacteria.
Let's go on to the next supplement, and that's turmeric. And
Mm.
I'm just curious as to what people use this for, what forms is it coming in? And again, if this is something like that's hot off the research that we should be recommending, or if we need to be a little bit leery of it.
Sure. Yeah, turmeric is a really popular supplement and it has been popular for quite a while now. So, turmeric being the plant, and then curcumin being the compounds that are in this turmeric, and using it for anti inflammatory generally. I see this more common in those that have some type of issue with inflammation, like arthritis, or I see a lot of youth in cancer thinking that, yes, it's functioning as an antioxidant to help reduce some of this inflammation. And in more preclinical work, like in cell culture or animal studies, there has been shown to be some benefit for regulating cell proliferation, inducing apoptosis, inhibiting angiogenesis, so inhibiting the ability to form new blood vessels in those cancer cells. So generally some anti-cancer activity in the preclinical model. So I see that it's very commonly asked about, at least about something to help reduce inflammation that may help reduce their joint pain or chemo brain fog kind of symptoms, or they're thinking that it might help with anti-cancer activity. Now, as far as the evidence, like I said, the preclinical work with cell culture or animal studies, sure, seems pretty exciting that there's this anti cancer activity, that it can function as an antioxidant, help reduce inflammation. But we do not have the clinical studies to support that. With the few studies that have been done in cancer, they use this in combination with therapy. So I always like to reiterate that point. This isn't a replacement for chemo or traditional therapies. So it has been studied in some clinical trials, not huge studies, but generally nothing really exciting there. And there's also some concern. I read a recent report that there has been some increasing reports of liver injury. And so, why you might not actually be seeing benefit in these human trials is that when you're dosing a cell, that you're directly putting that active compound on top of that cell in the petri dish. Or in animal studies, it can sometimes do like injections of this really isolated compound. When you consume it, the bioavailability, so how much actually gets absorbed and ends up in circulation and able to get inside of a cell to elicit action, is very, very low. So often, a lot of these supplements now are using things like nanoparticles, or there's a compound in black pepper that can improve absorption, or they'll have these little lipid particles around it to make it better absorbed, because generally the bioavailability of it on its own, not great. So there's been supplements now that are using a little bit more technology to enhance the bioavailability, but with those higher doses as well, that might actually increase the risk of liver damage and liver toxicity. It does have some drug interactions as well, so it can interfere with some CYP enzymes, as I mentioned earlier. And there was one study done in humans, again, a small study, but still enough to be concerned about it reducing the amount of active drug after taking tamoxifen. So, tamoxifen is commonly used in survivorship, breast cancer survivors, for either 5 or 10 years to help reduce the risk of recurrence. and to see that a turmeric supplement taking alongside this medication reduced the amount of active drug. So this kind of opens up a conversation of, with so many different compounds in there and so many different medications, it's really challenging to know how there's actually going to be this interaction in humans and whether that's going to be a positive or negative interaction.
So it sounds like to be determined almost, like there's not enough information
Yeah.
out there to really comfortably and safely recommend it. So if a patient is saying, "Hey, I heard, turmeric is a good anti-inflammatory. Do you think I should take it?" What would be the safest, best answer for the clinician to say, like right then and there in the office?
I'll say something I like to do with my patients is, let's learn more about this. So if you're feeling if there's joint pain, are there other things that we can focus on, like a more anti-inflammatory dietary pattern? Are you exercising? Are you drinking enough fluids, right, to help with lubrication of those joints? And I consider supplements as maybe a cherry on top, but you have to have these foundations in place. It is not going to be a replacement for the big picture stuff, the foundational things. If you want to reduce inflammation, turmeric is not going to offset if you're drinking a lot of sugar sweetened beverages and high fat foods and a highly processed diet and not exercising. Right. And so it's important to have that conversation about, are we approaching the lifestyle strategies first?
I love that answer. Because when you're in clinic and you're a clinician and they ask you a yes or no question, basically, you feel cornered to answer with a yes or no answer.
Mm.
And that was such a helpful way to answer that question because in the heat of the moment, we just feel so necessary to answer that specific question. But you helped us take a step back, zoom out, and say, okay, let's look at your actual diet. What are you actually eating? And are there things that we can correct without needing to add on a supplement?
Well, I really like that consideration. I never thought of that either, that the provider might feel cornered to answer either yes or no. And like, sure, I don't know, right? Or no, don't take any supplements. I often hear that from patients too, that their provider just said, no, I don't want you taking any supplements. And it might just be because it's faster to answer that way, right? And rather than get into some of this nitty gritty, say, well, I hear that you're concerned about how inflammation might be contributing to your joint pain. There's some lifestyle approaches that might help with reducing inflammation. Like we can discuss your diet or exercise, or how are you sleeping? Are you drinking enough water? And could start there.
This is why I love talking to dietitians because it's such a good reminder to ask about the basics and the foundation. All right. So for my final supplement, this is sort of the new kid on the block, but of course, super popular right now with social media and with the people who are promoting it. And that is athletic greens. So can you tell us, for my listeners who don't know what that is, maybe haven't heard it, what are athletic greens? And what are some things that we should be cautious about? And, or do you think it's great and we should be recommending that?
Yeah, athletic greens. Wow. That one, great marketing. They really capitalize on the influencer market as well. I hear it everywhere. Almost every podcast I'm listening to, there's an ad. And so athletic greens is a greens powder. So it is going to have some dehydrated green plants in there, but it's not just that. It also has proprietary blends of herbs and botanicals. It has vitamins, minerals, probiotics, and prebiotics in there. And yeah, that's what they love to market. It's all the different things. It's more than just a greens powder. And again, this brings me back to when I was talking about proprietary blends. This is one particular product in working with my cancer population that I'm very leery about and often am advising against, because they do have a proprietary blend of several herbs and botanicals, which some of them have been shown to interact with some drug metabolizing enzymes. Now, again, I don't know the dose. This is mainly theoretical, but why take that risk is really my approach to this. Like, why take this risk? If you really think that you need some more greens, we can talk about, one, how to incorporate this into your diet. Or if you're really set on getting a greens powder, we could talk about a greens powder that is just a greens powder and not all these other things as well. So I think for anyone that's saying that they're taking that, to understand that it's not just a greens powder. Looking past its name, yes, it's athletic greens, but it has a lot of other vitamins, minerals. And so if they're also taking a dietary supplement like a multivitamin and then a vitamin D and a calcium and omega-3, all of that stuff adds up too. And I think often patients kind of forget that. that they're taking all these different things that have multiple ingredients in them. And if you really add that up, you could be exceeding what's safe.
I think not only patients forget that, clinicians forget that. And that brings us back to that first question of asking your patients what additional supplements that they're taking. Because, like you said, if they're taking a greens and a multi and a calcium and a vitamin D and a probiotic, and they're hopefully trying to eat a little bit better, their diet alone might be sufficient. So they don't need to double dip into all these different supplements. So I think you make a really good point with that.
Yeah. And when you talk about that, like that's not uncommon that they're taking that many supplements. If people really sat down and looked at the cost of the supplements that they're taking, I think they might be surprised. I think it doesn't really show in your day to day how much that is, but over months and years, that can really add up. And one way that I approach this with my patients, like I understand like you're doing these things because you want to improve your health. So I support you in that. But could we take a closer look here about how that money might be better invested in helping you get some more fruits and vegetables in your diet? Maybe having a little bit of support for getting into exercise. Sometimes sitting down with dollars and cents can be helpful for them to see like, oh, wow, yeah, I am spending a lot of money in this. And we don't have a lot of evidence to support that that's actually having any benefit.
I love your approach. I think you're just so brilliant in this space. And I'm so grateful for the messages that you share on Instagram. And thank you so much for this time because I know my listeners will benefit so much, whether they work with patients with cancer or not. I think this topic is so important for all clinicians to be discussing with their patients, even in the pediatric world, in the space that I'm in. It's unbelievable the things that teenagers are taking nowadays because somebody on TikTok said to. So this topic and these questions to ask your patients are so vital. And Krystle, thank you so much for shedding light and just sharing research with this. I would love if you share where people can find you if they want to follow you on Instagram just to learn more about you and where they can hang out with you.
Awesome. I really appreciate the opportunity. And yes, I feel like this applied outside of the cancer world. I had to really dig into it because I work with this cancer population that does use a lot of supplements. So I'm happy to share that with this audience. And so if you'd like to follow me, I am on Instagram and TikTok at Cancer Nutrition HQ. My website's cancernutritionhq.com. I'd love to connect with you there.
Yes, her content is so amazing. She's so fun. She does Instagram lives and mocktail hours and stuff like that. So go follow her. You will learn so much from her, I promise. Krystle, thank you so much for the gift of your time. This has been incredible. I'd love to have you back on again for some more cancer topics.
I would love that. Thanks.
All right, now it's time for my nutrition notes. Now, I'll keep this short today because we packed so much into this episode already, but I wanted to leave you with 3 questions to ask your patients who are considering taking a supplement. Now, I really love how Krystle framed supplements as the cherry on top of an already healthful diet. Remind your patients that supplements are not a replacement for nutritious foods. They are supplements, which literally means something that completes or enhances something else when added to it. So the first question you can consider asking your patient is, why do you want to take this supplement? Or another way you could frame it is, what specific benefits are you hoping to get from it? Question number 2 would be, how are you measuring the effectiveness of the supplement in your health routine? And lastly, do you know if this supplement has been tested or certified for safety and quality? Now, in a recent episode, actually, it's episode 73, we discussed third-party testing and how patients can ensure they've chosen a quality supplement. So go back and listen to that episode when this one ends. Now, if you found this episode helpful, would you please consider leaving me a quick review on Apple Podcasts? It's a great way to tell me what you love about my show, and it really means a lot to know that you are enjoying my podcast. Well, that's all I have for you today. So as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.